The tiniest one, huh? Figures. Actually, I'm going to go a little proximal to it and make a bolus and push it in over it like this. I think that might do it. Make a tight fist.
Have you ever had an issue with patients presenting like a year later with any calcified nodule or anything?
I have not. No. Make a tight fist. I think we got rid of that vein. We're going to make your hands like the first slide. Those babies' plump, smooth hands.
I have to cut my fingers.
Oh. But a lot of it is this, is the massage. And to get it to go over into a continuous plane. Okay.
Any more tips to assure you that you're injecting in the correct plane?
I'm sorry?
Any more tips to assure you that you're in the correct plane?
It's a clinical experience, a clinical judgment, but it's sort of almost like a little pop. You just feel that you're in the correct place, and you know you are when there's very little resistance on injecting. You know that you're not in the dermis, and that you're in the areola space. So it goes in, and you watch the bolus come up pretty quickly with very little pressure. How about over here? Let's try to get that. Okay?
Mm-hmm.
Okay. Make a tight fist. Did that hurt at all?
No.
It's that lidocaine. Okay. So we're going to try to obscure. She had a big vein there over the 5th metacarpal. Oh my God. It's gone. I get amazed each time I do it.
It looks like minimal discomfort.
Almost none.
None. None.
Okay.
You're probably not moving.
None.
No, it's got lidocaine.
I don't like the needle thing, but...
And you have very few sticks.
At all. My hand feels numb.
Yeah.
I can feel him, but it feels numb.
Okay. Beautiful. Not perfect. This is not a full correction goal today. It's just to show you the technique. Let's go to the next hand, okay? Where's Neil? You have another syringe for me, Neil? Another setup?
Hold your hand up. Somebody took it. Why don't you think there's a bolus right here? Pump.
No, that's her.
You're ready a full syringe, right?
Yes.
So, and you said you didn't do every part of the back of the hand, so.
So she may
Fairly
need more.
small hands. So you're saying average at least 2 syringes per patient, but probably 3 to 4.
No. 2. I've never used more than 2.
2.
Yeah. Just make it tight. No, there's no bolus there.
Patients ever complain of tightness if they're doing handwork, knitting, or something like that?
No. I mean, this is already night and day, and we didn't touch up. I mean, look at the vein.
See.
Look at the 2 hands. Where'd you go?
I'm here.
Okay. The syringe? No, I need a syringe. The 3 cc syringe and the connector.
Mm-hmm. There should be a 3 cc syringe in there.
No, you know the one I like.
Yeah.
You can't use that again, right?
No. Thank you.
And
You can, but you don't.
what would you do, assuming that somebody came back a couple of weeks later and had a bump somewhere? Is there any remediation?
If there was a bump, I might take an 11 blade. I might, try to get it out. Neil?
The adapter, the big one?
Yeah. And you know what? Get the other ones ready too.
Okay.
So it'll make it faster. Let's see. And the syringe. Yeah, you could probably, if it was, they're not going to have a bump because if you are massaging this, it's really not going to be able. You won't have a bump you're going to be able to get out after all that massage. It's not like injecting lidocaine, Juvederm, and there you can clearly nick the skin and pop it out. But this is, I think, incorporated into the skin much more rapidly. I don't think you can. I don't think Radius you could extrude if you overcorrected it. Now, what am I doing? We have.
Occasionally get a little bit out, but not on the hand.
No, because of the way we're doing it.
What if you inject like lidocaine into that nodule and like massage it more? Would it be more malleable?
You mean, yeah, you're making it less viscous?
Yeah.
Maybe. So we're gonna.
1 cc dilution.
Yeah, I'm doing 1 cc. I upped it. The numbers are not in. It's really variable, between half and 1, and now I've just noticed I'm increasing it to 1. So here we have 1 cc of Lido, 2% plain. Again, the 1.5 syringe of Radius. And then 1, 2, 3, 4, 5, 6, 7, 8, 8, 9, 9, 10.
Is what you see at the end of the procedure is 25% lidocaine. Using a cc of lidocaine for 1.5. So, I mean, it's
Yeah.
more than 20%.
No, it looks like it's a third. You have one.
So
Yeah.
30%
So
is
some of this will be resorbed. Some of it will be resorbed. That's what I had mentioned in my article, the disadvantages of it. But it also helps with bolus dispersion when you have it not as viscous. But we'll see. Maybe with Robin, maybe the next patient will use less. Okay, you getting psyched? Neil, you have yeah. Okay, I see where we want to go. Okay, so we're going to get the left hand.
Yeah.
And we could have given you ice to put on beforehand, but you don't need it to numb. Okay, since you don't have Aquaphor on there yet, we should be able to lift up pretty easily. Yeah. Okay, so I'm going to go in right here, Jewel.
Can you lean back?
Me? Yeah, sure.
Everyone see? So I'm creating this tent, and I'm going right in the middle of this tent, and then I'm going to start injecting, and I feel no resistance, and I start injecting almost the whole syringe. And I know I'm in the right spot. I think that's a good size bolus. And that's when the first time I saw it, it was a little scary, and I watched the doctor do it. I said, "What are you going to do with that?" Okay, make a tight fist. But you know, in medicine, it's see one, do one, teach one. Okay, you ready? Get ready for that wow. I taught you that. Oh, wow. Oh, wow, look at those veins. They're gone. I'm doing all the wows. Julie, you had all these veins in the center there.
Wow.
We need to put in some more. The best thing, of course, is to see the before and afters, and I have befores on you. That's what really shows.
How much do you charge, or can we ask?
Usually it's between 900 and 1,000 per syringe. Radius. Radius is expensive.
How much is Radius
cost you?
About 3 and change. Maybe a little less.
Depending on how much you buy.
Yeah.
Buy a whole bunch of chips.
Okay, let's see. Where do we want to put more around this vein? Where do you want? This one, okay.
How far distally you go down to the...
Distally, I go to the metacarpophalangeal. I just want to try to obliterate this vein. Okay, make a tight fist.
Do you ever bring people back in 2 or 3 weeks and do touch-ups?
Yes, absolutely. That's the rule.
Do you save what you don't use?
No, they say since you mixed it with lidocaine that you're not supposed to save it, but I guess if I stick it in the refrigerator somewhere, I'm sure I could use it. But something? I almost have never I've almost never had extra left. There's always places to put it on the hand. Am I hurting you?
You find it's about 1 cc per hand? I mean, one syringe?
I would say closer to 2 if you want a really good correction. We're just doing 1 today.
But it's 1 syringe per hand, is that right?
No, 2.
2 syringes. So
2 probably.
So it's 4,000.
What? No. You give a discount when you're doing multiple. Okay, make a fist.
How long does it last?
I have a patient 7 months, a patient I have for 10 months, one for 6 months. Not the 2 years is, the hand is a very dynamic area as opposed to the face. I think the 2 years you're going to get in the face, but not in the hands that are moving all the time. Okay, just put your hand down.
What's left over can you use in the face?
No. Well, there's almost nothing left over. Let me see, do we have any left over? Yeah, you could probably use some more touch-up. We could use some more. But I'll do that maybe after Robin. So let's see. So I think we have night and day here.
Let's see.
Hold your hands up. She still needs a little bit more touch up here.
So you would go back.
I would go back here. I'd put a bolus in here, and then distribute it over here. This hand looks fabulous.
And you don't think this is a little bump?
No, I think that's Julie. See, put your hand down. No.
So you're talking
Patients
right
on
here.
anticoagulants really get a lot of bruising?
I haven't done patients with anticoagulants.
Would you do it?
Aspirin.
Aspirin.
I don't know about Plavix.
But this technique
Probably.
seems like the best technique.
Yeah,
to do on
probably,
people.
because I'm not going to have much bleeding. Yeah, put your hand down. That's her. I always go through that, but I can look at your pre's are up there, and see. I know the difference, but you definitely need more there. We definitely need a little bit more there, and if we have time afterwards, we'll do
You
it.
go in there too, or like medially here, or
Yeah,
yeah.
I go anywhere the patient wants me to go.
You got some left here.
We do have. Let's.